self-recognition and tolerance and rejection of transplanted organs. The self-recognition is the ability of the immune system to recognize itself, produce the antigens as a non-threat while appropriately mounting a response to foreign substances. The way the body is able to distinguish itself from foreign bodies are through sets of cell surface proteins. If a MCH cell is present on the surface of the antigen, the immune system will attack when it encounters it, as it recognizes it as itself. When the immune system encounters a new antigen for the first time, it does not identify, it will attack, and necessary immune system response will take place. The best way of avoiding a rejection of an organ is to match it as close as possible to that of the individual. 3 types of rejections take place. These are hyperacute, which occurs almost immediately after the transplant. Within minutes of the transplant being completed, and antigens would not yet be attached. Acute occurs within 3 months of the transplant. Everyone who receives an organ will receive some level of varying rejection. Chronic, this is when the immune system will damage the organ over a period of time. Some immune system disorders. There are many different types of immune disorders, some of which will be discussed. Rheumatoid arthritis is a disorder that affects joints, making movement painful, as well as the joints being swollen. It causes a combination of genetic hormones and environmental factors. There are times when the pain gets better and other times when it gets worse. Although there is no cure, early treatment and support can reduce this risk of joint damage and limit the impact of the condition. Treatment usually involves care from GP and several different specialists. Risk factors include your sex, as women are more likely to develop this condition, family history, smoking, and excess weight. This is just an illustration of rheumatoid arthritis. Biology of vaccination. Acquired immunity is the ability of the immune system to identify and respond to specific pathogens. Vaccination involves the introduction of a weakened form of a pathogen such as protein into the body. This allows the immune system to identify the pathogens and develop immunity without one becoming sick. The vaccination triggers to produce its antibodies, which is called active immunity. This immunity is long-lasting and provides complete protection than passive immunity. Passive immunity is short-term Naturally, a newly baby acquires passive immunity from its mother through the placenta. Natural immunity occurs when an individual is exposed to a pathogen and develops immune response through the normal course of infection. This type of immunity is often temporary and may not provide complete protection against future infections. Immunological memory is the ability of the immune system to respond to a pathogen that has previously been encountered. Immune response to vaccination following an immunization, some people may experience mild symptoms for a day or two, e.g. fever, chills, or fatigue. Vaccination help against serious diseases. Before use of childhood vaccination, deaths were more common from polio, measles, and although they still exist, the vaccination program provides greater protection from serious complications. Global benefits of vaccinations save the NHS thousands every year, as prevention is better than cure. According to the government health security agents, between 1940 and 2020, the rate of measles cases has been on a steady decline due to vaccinations. Herd immunity, also known as population immunity, offers indirect protection. Vaccines are not just for the recipient, but also for those too young or too old, too sick to defend themselves from preventable diseases. When caregivers, for example, are provided flu or COVID vaccine, this helps protect the people they support as well. Others don't have flu vaccines due to concern about getting the flu or other serious side effects. Although these myths can be dealt with by health professionals, individuals tend to believe non-professionals like friends, family, and work colleagues. According to the Center of the Disease Control and Prevention, recent studies show that flu vaccinations reduce the risk of flu illness by between 40 and 60 among the overall population. In conclusion, the presentation touched on the following: the non-specific defenses. It also touched on the specific immunity and the biological vaccinations. This is the bibliography, and this is the reference, and it brings to the end of the presentation. Thank you.